no matter what happens. Like other organizations, we have some events that are coming up in the months ahead, and we're looking to analyze those as well. So at the moment, we have all of our city facilities will remain open, and that could change as the hours and days go forward. So stay tuned for updates on that from Mr. Holden. We also have a number of public events that have been canceled in Regina and in Saskatchewan, and some events are upcoming for the city as well, and I want to reference those as well. The Imagine Regina Conference, the Isle of Regina Run, events at Alvarez Place, including ones that are happening tomorrow. We have an economic development conference that is being looked at, as well as city council meetings and committee meetings themselves. These are all being actively looked at the moment and being evaluated. We have not made the decision on those two, but again, in very short order, you'll be hearing about whether those continue on or not. So again, the city manager will talk about city operations in detail where we're at today. Fire Chief Lane, who's here as well, he's heading up our emergency planning and response team. He'll speak to his efforts as well. But the message I want to leave with residents is that we have confidence in what we're doing, our efforts, on behalf of the City of Regina and all orders of government. And I would encourage all members, all city people to look after themselves and one another. There's lots of good information out there, and we ask you to continue to look at those and go to Regina.ca/coronavirus to get information on the City of Regina's activities as well. But there's lots of important messages that really can't be repeated enough. And first of them is, of course, is take precautions like washing your hands and cough into your sleeve, practice social distancing, don't shake hands or hug, don't put your hands to your face. If you don't feel well, stay home no matter what. Arrangements with your work should be easy to be done. If you feel sick, again, stay home. If you have the symptoms, phone 811 or call your doctor to find out what you should do next. There are some populations that are at greater risk than others because of this, and we need to be mindful of that as well. So we just need to be cautious and aware and take care of each other. So we'll keep you informed as to what's happening with the City of Regina, but I want to let you know that the city manager now will speak about our city operations, and he'll take questions, and after that, Chief Jackson will talk about our emergency operations center, about what activities are happening there for replanning. So I'll turn it over to Chris Holden. Once he speaks and Chief Lane speaks, we'll take questions afterwards. Thank you very much. Chris?
Thank you, Mayor Frugere. So it's hard not to repeat some of the information that the Mayor has highlighted, but I think it's worthy of repetition. I think we need to hear messages over and over in the community because this is truly a community responsibility. I want to just remind everybody or inform everyone that the City of Regina has been in ongoing contact with the Saskatchewan Ministry of Health and the Public Health Agency of Canada since December of 2019 to monitor the situation, share information, and prepare a coordinated response. So this is something that has been on our radar since this really became an issue globally. The Saskatchewan Ministry of Health continues to assess the COVID-19 risk in the province, and as the Mayor has indicated, the risk right now remains low. The Health Authority is leading the response, and we'll talk about our EOC and our activation and just exactly what that encompasses so that, again, the public can have confidence in the city's relationships with how we deliver water and wastewater have changed over the last number of years. So water is provided by the Buffalo Pound Water Treatment Plant. They are a corporation of the City of Regina. And, of course, our wastewater is through EPCOR. So we are in close contact with those two organizations. They have business continuity plans in place, and we have every confidence that the relationships that we have, that they will be able to maintain both water and wastewater services for citizens. And at the end of the day, we are all in this together, and we are focused on the health and well-being of the community. The Mayor indicated for updates, if people go to Regina.ca/coronavirus, that's where information will be. At the end of the day, we have our regular service request channels and opportunities around Regina.ca, 777-7000. If people have questions, well, what about our buildings? What about your facilities? What are you doing? So in response to the concerns around cleanliness and hygiene, we have increased the maintenance and cleaning of our facilities, recreation facilities, City Hall, our transit buses, etc. it's really important to remember that if something is disinfected, it's a contact service, so whether it's a desk, a counter, this stand that you've all touched, it's disinfected until somebody comes in contact with it again. So although we all feel good if we see something being wiped down with a disinfectant wipe, I think it's really important that don't think that then it's a sterile, disinfected spot. It's disinfected until someone else comes in contact. That's why, going back to the mayor's point, going back to what the health agencies have said, hygiene, hand washing, right? Following protocols around coughing and sneezing are so important. So we're going to do our part, but it's really important that citizens and participants in our programs, et cetera, take that extra step to make sure that they're taking care of their own hygiene in terms of hand washing. There's a number of things that we're looking at in terms of our organization. So obviously we have fee payments and collections. We do water turn-ons, water turn-offs. We are trying to be as flexible as we can in terms of if people are ill, if people have to self-isolate, the expectation is that they will interact and communicate to citizens and will be lenient and flexible so that we're not inconveniencing people and people are getting access to the services that we need. At the end of the day, we have about 200 different lines of business, so from transit service to recreation services. As the mayor indicated, all of those facilities, all of those services are open today, but that may change by the hour, by the minute. Obviously, there is a concern about the gatherings in terms of large numbers. We're evaluating that. We're paying attention to that, and we may at some point, and again, it's close contact and communication with the health authority, we may be required to close a facility to restrict public access. A big concern for us is staff. We have 2,800 employees that deliver those programs and services to citizens. So we're doing things to make sure that we're protecting the health of our employees. So for example, where possible and where appropriate, we're encouraging people to work from home. We're obviously putting travel bans in place so that out-of-province travel, out-of-country travel, those things have ceased immediately. We want to make sure that we're maintaining a workforce. At the end of the day, if we lose half our workforce because they have been exposed to coronavirus, have the coronavirus, or have to isolate for some reason, then obviously we have to start to prioritize about service levels or services that we are in a position to be able to continue. So those decisions will be made, but like I say, we are taking action to make sure that we're protecting the workforce and keeping the workforce healthy. Again, there's lots of information, Regina.ca/coronavirus. Make sure that people are looking for regular updates and reaching out to Regina.ca, reaching out to 777-7000. If people have questions about our programs or services, we'll provide updates onto changes to our programs, our services. We have processes in place in terms of our recreation centers. What is the trigger point in terms of, closing a facility? And it's either information that we get from health, that there's a new concern or a new restriction being imposed, or it's the fact that we are simply challenged in terms of the availability of our staff to continue to deliver that service. So in situations like swimming pools, it's lifeguards, instructors, that becomes a challenge if we don't have staff. So those updates will be provided on an ongoing basis, so that if we have changes, obviously we'll do those through media, social media, and obviously we'll make contact directly with program participants. So I'll leave it there, and I'll ask Chief Jackson to come and talk specifically about our emergency preparedness and response and our emergency operations center activation.
So thank you, Mr. Holden, and thank you, Your Worship. So when the city first became aware and this virus was identified, our emergency preparedness and business continuity branch began monitoring the situation very closely. And then we were monitoring, and we are monitoring it in partnership with our health agencies, and that includes the Saskatchewan Health Authority, the Saskatchewan Ministry of Health, and the Public Health Agency of Canada. And it's through those partnerships that we've been able to stay current on the status of COVID-19. So this is a global and national health emergency. And we are working closely with our health agencies in partnership with them, and in order to coordinate and support their efforts and take their guidance to respond appropriately. So I want to stress that we're taking this situation very seriously. And at this time, we've activated our Emergency Operations Center. And the level of activation right now involves monitoring, reporting, and readiness. And that also includes activating certain roles within our emergency response team. So I want to talk a little bit about emergencies. And emergencies by their nature are dynamic and they're unpredictable. And we're seeing with this situation, the status is changing daily. But it's through that direct link that we have with our health agency partners that we're getting information pretty much immediately. So when things change, our partnership and our link with them is very good, and we receive those status updates nearly immediately. So we're taking our lead from our province and our health agencies and our health authority on just taking those appropriate measures that they're giving us guidance in.
So my question is, if you think you are infected, your symptoms